Hello everyone, welcome to Medicare 101, and whether you're turning 65 for the first time or trying to get some more Medicare information, you are in the right place.
Well, what happens if somebody misses their Medicare enrollment window?
The most important thing when you turn 65 is your initial enrollment period. And that's going to be 3 months before you turn 65 and 3 months after you turn 65. Now, if you miss that enrollment period, you could accrue a lifetime penalty. So if you're out there, you're turning 65 or going on to Medicare for the first time, super critical that you understand the different enrollment periods.
When should someone review their Medicare coverage?
When it comes to reviewing Medicare coverage, it depends on if you have a Medicare supplement or a Medicare Advantage plan. Medicare supplements, big misconception, you have to wait one time a year. You can review those plans at any time throughout the year. So if you just got a rate increase or the cost and coverage has changed on you, you can actually change your Medicare supplement just about any time throughout the year. When it comes to a Medicare Advantage plan, you need a special enrollment period or Medicare's annual election period, which is October 1st to December 7th. That's when everybody can make a change.
Well, my dad, he's not really happy with the current Medicare supplement plan that he's on. Is he able to change that, and when can he do that?
Yeah, short answer is yes. If you're not happy with your Medicare supplement or your rate's gone up, you can change that anytime throughout the year. The one restriction is going to be underwriting, so we're going to look at your health, your medications, and that's really going to dictate if we can get you a better rate or better coverage.
Why do some people pick Medicare Advantage over Medicare Supplement?
Yeah, what I always say is everybody's different, so everybody has unique, individualized needs. When it comes to Medicare Advantage, typically that's a lower cost plan, so it can be more budget friendly. When it comes to Medicare Supplement, that's more comprehensive, and that's really going to protect you and your assets. So it's really about what's more important to you, what falls into your budget, what falls into the types of individual needs you may have.
What mistakes do people make when choosing a Medicare plan?
The most common mistakes are just not getting educated. Maybe choosing a plan based on your neighbor or your friend or your relative, and that neighbor, friend, or relative doesn't have the same health concerns, doesn't have the same medications, doesn't have the same lifestyle. So it's really important to make this an individualized conversation with a specialist that knows exactly how to help you and what they're talking about.
How do prescriptions affect someone's Medicare plan choice?
Yeah, when it comes to Medicare and prescriptions, it can be an extremely confusing and overwhelming conversation. And I always say it's a very individualized conversation. And what I can say is we're gonna help you walk through that, and we're gonna input your prescriptions, choose your pharmacy based on your zip code, and find the right plan for you.
So what should someone do if they're turning 65 soon? I mean, where can they start?
Yeah, when you're turning 65, you may be working, you may already be drawing Social Security. There's a couple different scenarios that you fall into. And based on those scenarios are really going to dictate your Medicare path. And what I always say is education is going to be your best friend. So get educated. We have a Medicare 101 webinar. We have the 64 Plus book, a #1 bestseller, and there's tons of local free resources. So my answer to that is get educated. It's going to give you confidence, it's going to give you clarity, and help you make the right decision.
So what should someone bring to their Medicare appointment?
Well, when it comes to your Medicare appointment, really what you should bring is your unique questions. Everybody has questions that are important to them. Everybody has certain lifestyle choices they make, certain budgetary needs. So it's really more about bringing what is uniquely important to you so we can answer those unique questions and find the right plan for you.
What's the biggest financial mistake people make when choosing their plan?
Yeah, when it comes to Medicare financially, it's just overpaying for coverage. A lot of these plans are standardized. A lot of these plans are the same no matter which company you choose. So I just would never want my own parents to overpay for coverage. So that's the biggest mistake I see, is just overpaying or over-insuring yourself.
Do most people choose the right Medicare plan on their own?
Simple answer is no. I mean, I've been doing this for over a decade, and when I see mistakes, it's from people making uninformed decisions and working with kind of their neighbor or their relative and not using a specialist or somebody that's a professional in this field. So I think the biggest mistake that you can make is not using a professional. They're free and they're an advocate for you.
How much does it cost to use your services for you to help me find the right plan?
Yeah, when it comes to using a broker, our services are completely free, and I think that's one of the biggest misconceptions is when you use a Medicare broker, you're gonna pay the same cost if you do this on your own or use a professional. And the professionals are gonna be with you for as long as you live and help you make decisions not only right now, but year after year, and ensure you have the right plan as Medicare is constantly changing.
Well, what happens if your prescriptions change in the middle of the year?
Yeah, if you're on Medicare and your prescriptions change mid-year, typically that's gonna be done in front-end planning. We're gonna plan for maybe some unforeseen changes or some new medications being added, but we also have a one time a year to make changes. So October 15th through December 7th, that's Medicare's annual election period. We can make changes to your prescription plan during that time every single year.
If you're on Medicare and don't want a prescription drug plan, what happens?
Yeah, we have a lot of people that come to us and say, hey, I don't take any prescriptions, or I don't need a prescription plan, I don't want a prescription plan. And bottom line is, if you forego a prescription plan when you're first eligible on Medicare, you can accrue a lifetime penalty. Now, the important thing to know, that's only if you add a Medicare prescription plan at a later date. So if you decide, hey, I don't want one, you don't choose one, nothing happens. But if you come back down the road and say, I want one, they're gonna go back and penalize you for not having one when you pick that up.
What happens if you're still working when you turn 65? Do you still need to sign up for Medicare?
Well, Part A is gonna be free, so I always urge people to go ahead and sign up for Part A when they're first eligible when they turn 65. But the second thing you wanna do is, even if you're still working, we still urge you to compare your plans side by side. Put that Medicare plan here, that employer plan here, put them next to each other, and see which plan is best for you. Because oftentimes we see Medicare is still the better option. And even if you stay on that employer plan, there's still some major gaps and holes in coverage, and we're able to kind of fill those gaps and holes with what we call umbrella coverage and eliminate those major exposures.
What sets Gruening Health and Wealth apart from other agencies?
Yeah, I think first and foremost, it's the people. I mean, we have been in business for over a decade and have over 50 years of combined experience in our practice, and over 500 five-star Google reviews, and we're BBB A+ rated. So they don't just give those things out, and when it comes to the people, at the end of the day, that's gonna be what I lean on, and what I'm most proud of is the service and the people that we provide. And as we wrap this up, I wanna go through our 3-phased approach. So today, phase number 1, we're basically knocking out phase number 1. You're getting the Gruening Health and Wealth online content, today's educational workshop and seminar, and then you'll get a free copy of 64+, and that's a #1 bestseller that will really take today's presentation in a book format and help you kind of slow it down, maybe circle things and take notes if you need to. And then phase number 2, the most important phase, is schedule your free consultation. Make sure that you get your individual questions answered. And we have a ton of incredible people at Gruening Health and Wealth that are standing by, ready to answer those questions. We've serviced thousands and thousands of Medicare beneficiaries across the country, and again, have that 5-star service and BBB accreditation to prove it and back that up. So we'd love to talk with you, would love to answer those questions, would love to help you plan for your Medicare and retirement transition. And phase number 3, that's our free lifetime billing and claim service. So we have a great full service team that's gonna handle any billing, any claims, any service, and really provide you the holistic support on the insurance side that you're gonna need throughout your retirement years. So can't wait to hear from you, can't wait to answer those questions. And then again, I wanna remind you that every year we're gonna be there for you. We have our free annual reviews. So every year, October 15th to December 7th, that's gonna be another chance to meet and make sure you have the right plan, not just this year, but for years to come.